Welcome back to Divine Inspired Care. Today we will be looking at a very important topic, peripheral arterial disease. Do you know what peripheral arterial disease is? Well, let's get into it. Peripheral arterial disease, PAD, is a medical condition where the arteries supplying the limbs and the periphery narrow down. This narrowing process reduces the blood supply to these areas. Imagine a highway with lanes blocked off. The fewer lanes, the less traffic can pass through. That's somewhat how PAD works. While it can affect different parts of the body, it commonly strikes the lower limbs, such as your legs. So when we're talking about PAD, we're often talking about difficulties in getting sufficient blood to our legs. Let's delve into its symptoms. What signs should we look for to identify peripheral arterial disease? Let's start with the most common symptom, claudication. This might be a new term for some of you. Simply put, claudication is a discomfort or pain that occurs in your muscles when you're walking. It's kind of like a cramp or an ache, and it usually pops up in the calf, thigh, or buttock muscles. But here's the kicker, this pain tends to disappear when you take a rest. So if you're experiencing a recurring crampy pain in your leg muscles that comes and goes with exercise and rest, it might be a sign of peripheral arterial disease. But what's causing this pain? Well, it's all about blood flow. When you're moving, your muscles need more blood. But if the arteries supplying these muscles are narrowed, as in peripheral arterial disease, they can't deliver enough blood. This lack of blood can cause the muscles to ache and fatigue faster than usual. Now let's talk about a more severe form of peripheral arterial disease, known as critical limb ischemia. This is when the blood supply to a limb becomes so inadequate that the limb can't function normally, even at rest. Imagine having constant pain in your leg, even when you're just sitting or lying down. You might also notice sores or wounds on your feet or toes that don't heal, or heal very slowly. In severe cases, there could even be gangrene, which is when tissue dies due to lack of blood supply. These symptoms might sound pretty scary, and they are, because they signal that the disease has progressed to a critical stage. But recognizing these signs early can help you seek medical help promptly, which can improve your prognosis significantly. Understanding these symptoms helps us recognize peripheral arterial disease. But what happens if it's left untreated? Well, the complications can be quite serious if not addressed promptly and effectively. When the arteries supplying the limbs become narrow, the blood supply to these areas decreases. The result? Pain, even during rest. This condition is known as critical limb ischemia. It's essentially a state where there's an inadequate supply of blood to a limb, causing it not to function normally even at rest. The pain can be so severe that it disrupts sleep and daily activities. And then there are non-healing ulcers. These are wounds that don't heal because of poor blood flow to the affected area. They can occur on any part of the body, but are most common on the feet and legs. They're often painful and can lead to serious infections if not treated. Another complication is gangrene, a condition that involves the death of body tissue due to lack of blood supply. It usually affects the extremities like fingers and toes and can lead to amputation if not treated promptly. But it doesn't stop there. There's a significant risk of losing the limb altogether if the disease progresses. This is because the tissues in the limb become deprived of the oxygen they need to survive, leading to tissue necrosis or tissue death. Acute limb ischemia is another possible complication. This is a rapid onset of ischemia in a limb, typically due to a thrombus or a clot blocking the arterial supply of a distal limb. It's quite similar to a myocardial infarction, also known as a heart attack, where a clot blocks the supply of blood to part of the heart muscle. In the case of acute limb ischemia, the clot leads to inadequate oxygen supply to the tissues due to reduced blood flow. The consequences: tissue necrosis and, in severe cases, gangrene. These complications sound severe, right? So, how can we manage peripheral arterial disease? Ever heard of atheromas and sclerosis? They play a crucial role in peripheral arterial disease. Let's dive into the fascinating world of atherosclerosis. Atherosclerosis is where atheromas, or fatty deposits, team up with sclerosis, the process of hardening or stiffening of blood vessel walls. How does this happen? Atherosclerosis is actually a result of chronic inflammation and activation of the immune system within the artery wall. This is what happens in our arteries. The immune system, our body's defense, is activated, but the invasion of lipids, or fats, is persistent. These fats are deposited in the artery wall, creating a beachhead for the formation of fibrous atheromatous plaques. These plaques, much like unwelcome guests, cause stiffening of the artery walls, which leads to hypertension or high blood pressure. This puts an enormous strain on the heart as it tries to pump blood against this increased resistance. But the plaques aren't done yet. They also cause stenosis, or the narrowing of the arteries, reducing blood flow. Similarly, reduced blood flow can lead to conditions like angina. And if a plaque ruptures, it can lead to a thrombus or clot, blocking a distal vessel and causing ischemia, much like a traffic jam, causing delays. Now that we understand atherosclerosis, we can see why managing risk factors is so important. How can we reduce our chances of developing peripheral arterial disease? It all comes down to understanding the risk factors involved. Some of these factors are within our control while others aren't. Let's explore these further. Let's start with the non-modifiable risk factors. These are elements that we cannot change. They include older age, a family history of the disease, and being male. While we can't alter these factors, being aware of them can help us stay vigilant about our health, especially if we fall into these categories. The good news is that many risk factors for peripheral arterial disease are modifiable. These are areas where we can make changes. Smoking, for instance, is a major risk factor. If you smoke, quitting is one of the most effective ways to reduce your risk. Alcohol consumption is another modifiable risk factor. While moderate drinking may not pose significant risks, excessive alcohol can contribute to the development of peripheral arterial disease. Cutting back or quitting altogether can make a massive difference. Your diet also plays a critical role. A diet high in sugar and trans fats and low in fruits, vegetables, and omega-3s can increase your risk. By opting for a balanced, nutritious diet, you can help keep your arteries healthy. A sedentary lifestyle, marked by little exercise, can also contribute to peripheral arterial disease. Regular physical activity, on the other hand, can improve circulation and overall cardiovascular health, reducing your risk. Other modifiable factors include obesity, poor sleep, and chronic stress. By addressing these factors through weight management, prioritizing good sleep, and finding healthy ways to manage stress, you can lower your chances of developing peripheral arterial disease. In addition to these lifestyle factors, certain medical comorbidities can increase the risk of peripheral arterial disease. These include diabetes, hypertension, chronic kidney disease, and inflammatory conditions like rheumatoid arthritis. If you have these conditions, it's crucial to manage them meticulously to minimize your risk. Certain medications, such as atypical antipsychotics used in schizophrenia, can also increase the risk. By understanding and managing these risk factors, we can significantly lower our chances of developing peripheral arterial disease. Remember, prevention is always better than cure. That's all about peripheral arterial disease. We've covered a lot of ground in this video, from understanding the symptoms and complications of this condition to exploring the role of atherosclerosis in its development. We've also delved deep into its risk factors, both modifiable and non-modifiable, and how we can manage them to reduce our chances of developing this disease. Now it's your turn to spread the word. If you found this video helpful, please share it with your friends, family, and anyone else who might benefit from understanding peripheral arterial disease better. The more we know, the better we can protect ourselves and our loved ones from this condition. Don't forget to like this video if you found it useful, and comment below with any thoughts or questions you might have. And of course, subscribe to our channel for more health-related content. We regularly post videos on a wide range of health topics, so stay tuned for more. Remember, knowledge is the first step to health. Stay informed, stay healthy. See you in our next video.